So why do most people default to surgery? Part of it is the MRI. When you see the word tear on an MRI report, your brain screams something's broken. And when something's broken, the natural instinct is to fix it. Another part is fear of missing out on work, being benched from sports, fear of living with it that just doesn't feel right. Surgery offers the illusion of certainty, even though it is very effective. It feels like action. After a lateral meniscectomy, that's when they remove part of the torn meniscus. The progression of arthritis accelerates dramatically. One study found that the rate of joint space narrowing was 27 times faster in the first 12 months after meniscectomy compared to non operative care. That's not a small number. That means that Mark could feel better in the short term, but the cost might be accelerated arthritis and a higher risk of knee replacement down the line. Now compare that to a meniscus repair, where they actually stitch the torn tissue back together. Repairs have a much lower arthritis risk than meniscectomy. At 8 to 9 years follow-up, about 80% of patients had no arthritis progression after repair, compared to only 40% after meniscectomy. So the risk still isn't zero. Repairs carry about a 10 to 15% arthritis rate long-term, versus 2 to 3% in people who had never had surgery at all. So the spectrum looks like non-operative care carries the lowest arthritis risk. Meniscus repair is the middle ground, and then meniscectomy carries the fastest arthritis risk of progression. And yet here's the complex part. Meniscectomy is still the most common procedure. Why? Because the psychology of pain is very powerful. When your knee hurts today, it's hard to worry about arthritis in 10 years. When you're told surgery will get you back to normal in 6 weeks, it's hard to choose 4 months of rehab instead. But here's what I want you to understand. This isn't just about your knee today, it's about your knee for the next 20 years. Let's talk about what these paths actually mean for your life, because this is another layer patients rarely hear in the consult room.